Good afternoon. I'm George Latimer, Westchester County Executive. This is Monday, December 21st, and we're here at Westchester County's Department of Emergency Services to give you your weekly, or the first of the two weekly, Westchester coronavirus updates. This is an opportunity to tell you a little bit about where we are in dealing with the coronavirus outbreak that really began back in March, so we're now in the process of completing our 10th month of going through this process, and then also to talk about some related issues that we think would be helpful and interesting. We intend to do another update before the end of the week. Of course, Friday is Christmas, and so we'll do it just before that. And then next week we'll have an update on Monday, which will be, I believe, a telephone update. We'll do that in that fashion, and then later in the week we'll have another visual update, which will close us out for the year. We're going to talk a lot about statistics, as we usually do at the beginning of the report, and about statistics that the county will try to format. But just for the opening, we always begin with what's happening statistically, and the data that we use comes from the New York State Department of Health tracker. It is available to you. If you want to go on to the internet, you're able to see these numbers for yourself. With one or two exceptions, all of these numbers are available. You have to go through the document to find it, and it's available, provided by the state, for all of the 57 counties and the 5 boroughs of New York City. We'll talk a little bit about subdividing this information in a second. The numbers through Sunday, December 20th, show that we've had a total number of 62,940 positive tests for COVID in Westchester County. 2 weeks ago, we had 54,671 cases. That means over the 2 weeks between the 20th of the month and the 6th of the month of December, we have 8,269 still active cases. And an active case, by the definition, is someone who tested positive and has not gone 2 weeks so that they have cleared the protocol to show that they haven't been sick and therefore they have beaten the COVID infection. That 2-week period of time is a public health number that's been used throughout the course of the pandemic, and so the subtraction from 2 weeks ago to today leaves us with 8,269 cases. Now, that number of cases is very high if you go back just a month ago. If you go back a month ago to the 20th of November, which was just before Thanksgiving, we had a number of active cases, 4,344. So the numbers have doubled in terms of active cases between November 20th and December 20th. However, the numbers that we report for Sunday, December 20th, have actually gone down since the peak of Tuesday. So 5 days is not enough of a period of time to really assert that we have a longer range trend. But we peaked at 8,771 active cases on Tuesday the 15th. And for the first time in 8 or 9 weeks, that number has actually gone down in the last 5 days from 8,700 in round numbers to 8,200 today, or actually as of yesterday. So that drop of 500 cases is a good sign. It could represent a bunch of different things, so we don't want to interpret it too much. It could represent the fact that there are less people testing positive, so it's a reduction in the infection rate. We're still getting over 500 positives, new positives a day. On Sunday, we received 535 positives in that day against a total of 8,495 tests. So if you do the math, clearly that's above a 5% ratio of number of infection. 95% of the people tested negative, over 5% of the people tested positive, so it's 94 to 6, somewhere in that vicinity. We have tested year-to-date 1,308,901 individuals, and of course that by definition is multiple number of tests. We have slightly under 1 million people in Westchester County. We'll see what the new census tells us. But if every man, woman, and child had had a test and everyone is not, the 1.3 million puts us over that mark. So that means clearly there have been multiple number of tests for people to come up to this 1.3 million mark. I myself have been tested twice during the period of time, and there's many people for whom their job requires more constant testing. So it's not a one-to-one ratio, but that number of 1.3 million is a significant number, and it still remains a high percentage of testing that's going on, which the public health professionals say is essential in order to track the spread of the contagion. Now, in addition to looking at how many active cases we have, right now 8,269, we then look at, of that group of people, how many are hospitalized, because the degree of illness is such that you might test positive and you might quarantine or isolate rather at home, and your antibodies, your natural defense system will defeat the virus, but you have to stay home to do it so you don't spread it to anybody else. Those people that manage to overcome the virus without being so sick that they have to go to the hospital is the larger quotient of people. However, a portion of those people do get sick, do wind up having to go to hospitals for special attention. And the last number we have of hospitalizations dates the day before this. On Saturday, 353 people were hospitalized for COVID. 353 out of the base total that we're talking about gives us a percentage in round numbers at around 4%. So it's good to know that of all the people that contract the disease, only 4% of them at this point in this area have become hospitalized. Now, one of the great issues that are being talked about nationwide is what is your hospital capacity so that if you have a large number of people that need hospitalization, that you have sufficient beds. If at current purposes we're at round numbers 350 to 360 people hospitalized, we have in the vicinity of 2,400, 2,500 hospital beds in Westchester County. At the present time, there are people in the hospital for other reasons. People who have other illnesses or operations and so forth. But the COVID population is 353 the last time we checked, and if it has to expand by any exponential amount, we in theory can move out elective surgeries from various hospitals. This would be a decision made by the governor, not by the county executive, but we could free up hospital beds that would allow COVID patients to get help. Why is this important? Because when you turn on TV, you're hearing stories in St. Louis, in California, and other places where there's not enough hospital beds to deal with people who have COVID. And you're not going to be able to successfully treat somebody on a cot in a hallway or in a gymnasium or in some situation. And since this disease is highly contagious, you can't put them in any kind of a group setting for treatment. If we had an accident of some terrible nature in which people broke bones, you could, in theory, have them on, in a widespread area on cots being addressed, but not with a contagious disease. So in this particular case, 353 people the last time we checked were hospitalized for COVID. Now, the number of hospitalizations tracked in weekly intervals was roughly flat over the prior week. What was 353, a week before that was 348. 2 weeks before that, it was 321. That's not a huge variation in numbers. You do go back to the last week in November, which would be 3 weeks ago, and you'd see there was 244 hospitalizations. So 244 to 353 is a jump. That's roughly about a third of a jump. And if you go back the week before that, which was just before Thanksgiving, 168 people. So a logical assumption is that we had Thanksgiving in the middle of that period of time. And while we had contagion with more people, slightly more people getting tested, many more people wound up being hospitalized as a percentage of what we had before Thanksgiving. Was lower. After Thanksgiving, it was larger. And we've talked about what is spreading the disease. We don't know precisely. Every spread is a different story depending on the individual. But we have shut down almost every public activity and event that you can have. You're not going into sports arenas, you're not having parades, you're not having holiday Christmas parties. In offices where you work, offices are reducing the amount of people that come into work, less people on mass transit. So how is the virus spreading to this degree? Well, to the greater extent, it's spreading in in-home settings where people meet with other people and one person has the disease and can infect the other people of the family. And for Thanksgiving and now coming up for Christmas holiday, the chances of infecting a group of people in a family is much greater. And I think that's what we're seeing in terms of the number of people hospitalized and the number of people infected, that in the post-Thanksgiving period, there has been a spike. We've had a steady rise from the end of September into November, and now on top of that steady rise, we've had a spike. And that's a concern, and it should inform our behavior a few days ahead away from the Christmas holiday. We have no mandate or policy from the county level that you must do this or you can't do this. But as I've said in the past, you have to use common sense. You have to try to protect those in your family that are most vulnerable, those who are of advanced years, those who may have any kind of a compromised immune system, those individuals that have had some chronic diseases and so forth. Those members of your family are more exposed to a bad reaction if they catch COVID. And that should be something that you should think about as you make your plans for the holiday season. And we all understand how important Christmas, as Thanksgiving is a time for people to get together to meet. It's a human reaction. It is within our culture that it's important to get together, and New Year's follows that. But we've certainly seen an increase in infection and a general increase in hospitalization, although I have to note, as I said, we were basically flat the last week in terms of additional hospitalizations. That's a good sign. Let's see if it stays flat or starts to decrease over the next week or two. And if those things happen, then we'll be very grateful for what would be a bit of a downturn in what we've seen. We saw the virus extend itself March into April and rise rapidly, and then it leveled off. You remember the dialogue at that point in time was flattening the curve. The curve that goes up got flattened rather than peaking. If it had peaked, the concern is you'd run out of hospital beds, you'd run out of PPE, you'd run out of doctors, you'd run out of ventilators. So we didn't have that problem in the spring. We hope we won't have that problem here as we look at these numbers. The number that is immutable is the number of people we've lost, fatalities. As of the report from Sunday, 1,606 people have lost their lives to COVID. That number, unfortunately, is 44 higher than it was a week before. So 44 people passed away in the last week. If you go back to the week prior to that, we lost in the vicinity of about 35, 33 people. So 77 people have died in the last 2 weeks. That number compares unfavorably to where we were during the summertime. I often quote that from a 2-month period of time, from the beginning of the first week of July to the beginning of the first week of September, basically, Independence Day to Labor Day, we lost 11 people in the county. And I've just reported we lost 44 in the last week and 33 in the last 2 weeks. So the fatality factor is concerning. And these numbers give you different indications, right? We have a slight downturn in active cases, but we have a significantly higher infection than we had previously. We're about flat in hospitalizations, but we have a greater incidence of fatalities. And all of those numbers are not just numbers to look at and to discuss as if we were discussing the relative standings of the NFL and which teams are, in what positions for playoffs. These are human lives that are affected by each of these situations. Now, the most logical thing that follows giving countywide statistics is to know what's happening in the community I live in. And most people, if you ask them, where do you live, they don't say Westchester. They say, I live in Armonk, or I live in Yonkers, or I live in Peekskill, or Pelham, whatever their home community is. And most people travel in the community they live in, a community they work in, and then, within a few miles sort of parameter. If you live as I do on the Sound Shore, you tend to be in the Port Chester to Pelham corridor more than you are in the Peekskill to Ossining corridor. If you live in the far northeastern corner of Westchester County, in the spacious areas of North Salem and Lewisboro and Pound Ridge, you really have to have a reason to be in the heart of urban Mount Vernon or urban Yonkers. Maybe you work in that environment, maybe you have friends, families, relatives, but more likely than not, you don't journey to other parts of the county. So it is realistic that the elected officials and the people who live in Westchester County want to know what's happening in my backyard. What's happening with each of these different issues. George, you report on total number of cases, infections, hospitalizations, deaths, what's happening in my community. The first most important thing you need to know is that the county government does not receive directly any of the information that makes up the statistics that we report on. We get our statistics directly from the New York State Department of Health tracker, and that's because the hospitals, the nursing homes, the testing centers report directly to the state of New York. They are regulated by the state of New York. If you see a nursing home and it's located in White Plains, the city of White Plains, or it's located in the village of Hastings-on-Hudson, they do not report to the village. They do not report to the town. They do not report to the county. They are licensed and regulated by the state of New York, and the state of New York can therefore mandate that information about hospitalizations, fatalities, number of cases, number of people infected are reported to the state of New York. The state puts out data and breaks it down by counties and the 5 boroughs of the city of New York. So we draw that information to give you countywide statistics. But now the demand has been, and it's a reasonable demand, from local officials and residents, what's happening in my community. County, you need to tell me what's happening in my community. And we can't do that unless we get information directly from the state of New York. Now, the state does provide to the county and to the local governments information about individuals who have tested positive for COVID. That information about individuals, their address, is very much subject to laws that the federal government has established under legislation. Acronym is HIPAA. It involves a Privacy Act for individuals and what you can and what you can't reveal. Westchester County and the other counties of New York State receive information on those individuals for one public purpose, and that is so when we dispatch 60 Control, Westchester County's emergency services operation, where we are, not physically here, but within this department, when we dispatch EMS or fire purposes, they need to know when they go to a house to deal with an issue, is there a person who tested positive for COVID? Why would they need to know that? Because they need to have protective equipment on. They can't expose themselves to the contagion because they're responding to somebody that needs immediate EMS treatment, has to be brought to a hospital, and we don't know that they're COVID. So that information is shared in a share file, which is located both at the county and in the municipal levels. However, we are restricted from revealing the specific information about specific individuals. And just to reinforce that point, I'd like to ask Deputy County Attorney Justin Adin to join me here just to talk through so you understand what the legal provisions are that affect what information can and can't be revealed to the public. Justin.
Thank you. So, as the county executive said, the federal government has passed an act known as HIPAA. This has existed since the 90s, and the primary purpose is to protect people's information. It's for you, as a medical patient, to protect your information from disclosure and to make sure that you can have access to your information. The biggest part of HIPAA that most people know about is the privacy rule, and the privacy rule says that your personal health information can't be disclosed without a specific legal purpose or without your permission. And so generally for our purposes, there are very limited exceptions for HIPAA for taking care of the public health. It's when you're responding to a public health emergency, you can disclose the limited amount of information, and it's got to be the most restricted amount of information necessary and only to the people who absolutely need to know it. A common question is, why can't I know if my neighbor has COVID? And this is not something that we just get in county government, but I've had members of my family asking me this question. And the answer is, there's not a public purpose in disclosing that information, so HIPAA doesn't allow it. To make sure our first responders are appropriately protected when they have to respond to an emergency is a very limited public function that requires disclosure of this information. To go beyond that, to generally broadcast people's names and addresses, doesn't serve a public purpose, and it violates people's privacy rights. So that's why if somebody asks, is my neighbor sick, we can't disclose that information. Now, state and even local laws dealing with communicable diseases, which COVID is, again, limit the ability to disclose any private health information unless it is absolutely necessary for an express public purpose, which, again, the situation, when we talk about providing it for emergency response, that's public purpose. When it's general disclosures because people are curious as to if there's somebody who lives near them has COVID, would violate HIPAA. And this is very important, not just in the COVID aspect, but in the aspect of all medical information. One of the things that you want to encourage people to do is to go out and seek treatment for something like COVID, to go out and seek testing. If people know that their private information is going to be broadcast generally, they're not going to do it. So that's one of the reasons why the federal government, state government, and county government takes very seriously the limitations that HIPAA imposes and does not disclose this information to the general public. Thank you.
Thank you very much, Justin. Justin Adin, Deputy County Attorney. We want to thank Justin, his colleagues in the law department, including our County Attorney, John Nona. So it is clear legally that we as a county government, nor the local governments that have any of this information that we're provided, cannot release any specific information. And just as Justin said, somebody may say, I live in an apartment building. I want to know who has COVID in this building. Legally, that information cannot be provided to you. That's not a decision of the county government. That's not your village, your town, or your city. That's not the state government. That's federal law. And if we were to disclose that informally, let me tell you, on the third floor, Mrs. Jones has got it, we're subject to civil penalty and potentially incarceration. So part of what the public wants to know is not legal to disclose. You need to understand that, so that which information you can get is realistic, and we strive to get realistic information and within the lines that Justin just outlined of legality. Now, we have struggled trying to provide some information from the county, getting information from the state, and then trying to collate it in a fashion that then can be distributed. And we have had now, for the better part of 5-6 months, distributed a map 5 days a week on weekdays that give an idea of how many cases of COVID are available. That information comes from the shared file information we have. Now, the information that comes into the shared file, that's a computer file that each of the municipalities have, we have as a government. We can put somebody in there, go through that. We can't mention names or specific addresses, but we can look and see the community that they live in and come up with a number. How many of these cases are from New Rochelle? And then we can cross-reference it against all the cases that have happened in New Rochelle, so we can provide publicly two bullets of information that you hear me provide countywide, and that is total number of cases year to date, and how many of those cases have been 2 weeks qualified out, which will give you the number of active cases. And that is the information that we have shared in our map over the last few months. It started out with just an aggregate of accumulation of cases, and then we modified it to give active cases and total cases. So we added that extra bullet. The reality is that we have to go through raw data to be able to update it, raw data which we may not get in real time as the state releases that to us. Remember, they're not releasing it to us so we can put out a statistical report. They're releasing it to us so that when we send out EMS people and fire people into the field, that they'll know whether or not they're going into a case situation. And the reason why local governments get this is not every fire department and few if none of the police departments are dispatched through 60 control. So there's a local dispatch function for police departments and some fire departments, maybe some EMS departments as well. There's so many different permutations in Westchester County. No one statement covers everybody. So there is a reason to provide local information in the village, the town, and the city hall that you would have of cases of individuals, so that if the local police department is dispatched by the Bedford Police Department or by the Pleasantville Police Department, they too would know what we know at 60 control. But we receive no data on hospitalizations. We receive no data on deaths. And as I've said, every time I've given these numbers, you need to see a series of data points in order to make an intelligent judgment about what's happening out there. If I told you, as I just did, that over the last 5 days the number of active cases has dropped, that would be a good sign. And that would be the totality of information right now that we share with the municipality, is active cases. But that doesn't tell the whole story. So I made the decision last week, as county executive, not to send out the map until we could understand exactly how we could improve the information out there. And why is that important? Because when we give you information, you rely on it. You look at it, you say, okay, there's these many cases in my community. You draw judgments based on that. If those numbers are inaccurate, if they're 3 or 4 days off, it might not be a problem when there's 20 or 30 new cases a day, as there was back in the early part of the summer. But now that we're having 500, 600, 700 cases a day, if your data is 3 days old, you're missing 2,000 cases in the information that you provide. And you're looking at the map, believing it's completely accurate because the county is sending it out. The county is getting information from the state, and we look at it and we go, whoa, the gap is now 2,000. It's not a couple, it's not 60, 60 cases. It's 2,000 cases. We're putting out information that is not accurate enough to satisfy us, and it's not complete enough. So I made the decision to pull the map. Now, we're working on what we hope will be something that I'd like to say would be out there before the week is over. We're going to strive for that, knowing that, again, there's a Christmas holiday coming up on Friday. And what we will be doing is providing a map that will be available to you that you can link on and look at directly anytime you want, rather than waiting for a daily preparation of a physical map. You will see a map of Westchester County. It'll have the advantage of being color-coded, a little easier to see. You'll be able to click on certain links, and you will find out information about total cases and active cases as part of that information. I believe it may also give capacities of various hospitals, but we'll see exactly what information we can put out there. What it will not tell you, and this is what we are asking the state to provide us with, is information on hospitalizations and deaths. Why is that important from a substantive standpoint? Because the governor has indicated that he and his key executive team are making decisions about whether or not to move into yellow, orange, or red zone capacities, which reduce a certain amount of activities, reduces restaurants, reduces schools, reduces houses of worship, on the basis now shifting from infection to hospitalization availability. If we have enough hospital beds and we have enough PPE and doctors, then we can handle whatever the spread of the infection might be. And as we make that transition, the number of people hospitalized becomes a more important number. We only have the aggregate number that I've reported to you, the 353 number. So I've asked in writing that the state provide us with the opportunity of hospitalization information and then also fatality information. Now, I understand that in the world of openness and transparency, people want to know what they can know about government. I've been a supporter all my life of these things. I've advanced them through various different positions I've had in public office. The ability to provide you information that is legal to provide under HIPAA is more of an organizational challenge, with the state releasing information to us, which then can be put into this interactive map, so you would be able to click on and see the data that you need when you want to see it, updated to whatever date the map says it would be updated to. I would not expect to see real-world data that you click on Monday, December 21st, and you would see Monday, December 21st information. I would expect there'd be a couple of day lag time. But the state has to authorize the county to receive information about hospitalizations and deaths. The hospitalization data is available at the 11 hospitals of Westchester County, but they are not authorized to release that information to the county. We are seeking that authorization. If we get that authorization, then we can provide in this electronic map the ability for you to look on, click on, I'm not playing with the dashboard as we speak, but you would be able to look at active cases and hospitalizations broken down by municipality, and then the same would be true of fatalities. But that information is reported to the state, not to the county. We need the state to allow us to access that information, and then we need to put manpower, people on it, to be able to go through, research the information, and get it right. And for anybody who's lived in Westchester County, you know that this county, every county, can be confusing in data. You can live in the 10583 zip code, which we know to be Scarsdale. But if you put an overlay of governmental jurisdictions, you will see that the Scarsdale zip code covers the village of Scarsdale. Part of it goes into the town of Greenburgh, Edgemont neighborhood. Part of it goes into northeast Yonkers, 10583 zip code, but you live in Yonkers. It says Scarsdale, but you live in Yonkers. Part of it goes into a section of Eastchester. Part of it goes into the town of Mamaroneck. And you would need to know that, oh, this street is actually in the town of Mamaroneck, even though it has the same zip code, 10583, as a street in Yonkers. We didn't create the zip code system. The zip code system was created by the United States Postal Service, and it did not respect jurisdictional lines when it was created. They did their ability to deliver mail and receive mail on the basis of what was convenient for their effort, and they did not say, oh, if this is the village of Scarsdale, let's have a zip code just for Scarsdale. So you have many overlaps like the one I'm describing, multiplied out. There are systems that we have in place that can go through that, but what it is not as simple as somebody might think it is. Just tell me everybody that's in Scarsdale. No. You're going to have somebody or some system that correlates out the addresses and can identify that this zip is Scarsdale Village, same zip, Scarsdale is Yonkers, same zip, Scarsdale is Greenburgh, and be able to do that in order for you to get accurate information. And it's complicated by the fact that in the city of Yonkers, the largest city, there's a part of Yonkers that has the Tuckahoe zip, a part of Yonkers has the Bronxville zip, and on and on. I say these things not to draw out that it is impossible to do these things, but when someone says to me, why did you pull the map? Because I don't want to report inaccurate information. I want to report complete information because I want all of us to have accurate data. The report that I give you is from a state tracker that I'm told has accurate data. I don't want to then put out something that doesn't correlate to the state tracker and may or may not have accurate, up-to-date information. However, we seem to be in a position now where we'll be able to create something online that will give you some of the data, the active cases, total cases, and we will strive to get the state to allow us to put data in that would allow for hospitalizations and fatalities. And then, when I report to you today, here's the information we have as of Sunday the 20th, you could go onto the tracker. It might say updated as of Wednesday the 16th, but the Wednesday 16th data you have correlates to the Wednesday the 16th data that I presented when I last gave the update. That is a reasonable expectation for local officials. That's a reasonable expectation for our residents, and that is what I'm striving to do, so that you understand clearly what the rationale is. Now, people get on Facebook, they won't see this presentation. If you're seeing this presentation on Facebook, by all means, send it to a friend of yours, or put their name in down there so they'll come on and see this presentation, because we cannot do a mailing to every man, woman, and child. And I'll go onto Facebook and somebody will speculate they're hiding something or they don't know what they're doing up there. Maybe I don't know what I'm doing, but the vast majority of Westchester employees know exactly what they're doing. And let's not assume that they're not professionally dealing with this issue in every way possible. But that summarizes where we are with information, the map, and where we intend to go in the future. I hope when I have the report later this week, I'll be able to establish a date for you when the map will be operative. I hope it'll be the day that I give the updated report, but we have to make sure that our information technology system can provide that information, provide it regularly and accurately, and then this will get us past this issue of the moment of knowing what happens. Now, we can know anything on the planet, but we have to do something with our knowledge. And just to give you statistics as we do for your information does not tell you what we have to do in order to deal with these issues better. We're here today at Emergency Services because we have something that is technical and it's better. And I am completely unqualified to explain it to you in any great detail. The program is acronymed CAPR, and CAPR is the acronym, and it represents a rather intelligent way to protect people from access to the coronavirus in a way that also creates a better connective between individuals who may have coronavirus and now have to deal with a healthcare professional. I'm going to have to rely on my friend, Chief Mike Volk, of the EMS and Communications Division of the DES to come over here and sort of orchestrate what we're going to cover, Mike. I'm going to learn as well as everybody in the audience is going to learn. So bring all these professionals over. Get Niall over here, who's ready to land on the moon. And Mike, I turn it over to you for your explanation.
Thank you. We had talked a lot about how contagious this disease is, and the county Department of Emergency Services, through the support of the county executive and some CARES funding, have purchased some cappers, or a continuous or a controlled respirator. This is a little bit different than what the EMS providers would use day to day. What we refer to as PPE. We have face masks, we have N95 respirators. These are hard to come by. We've been struggling with those for months. Still to this day, it's hard for their EMS providers to get this equipment. So we wanted to get some new tools, some advanced tools that they can reuse and keep them safe. To my right is Brett Roberts. He works for our EMS division. In his garb, he has protective equipment. He has his gown on to protect it from any splash, his gloves on for any fluids, and then he has a capper on. The capper is a little bit different than the normal face mask and the face shield. Number one, it doesn't require a medical clearance as an N95 does. It does not require fit testing as N95 does. And when you fit test for an N95, you have to destroy one mask to actually test it. So, and it has to be the same brand, the same model and everything. So we purchased these Max Air cappers. So if you can see here, you have a full face mask. You have a fan controlling the filter in here. It's actually blowing air on the provider, and it's positive pressure. Unlike this mask you can have, if you have to take a deep breath and doing EMS, and you can see my partners from Ossining and from Portchester here, the leadership for their EMS agencies, they know when you're moving somebody heavy or you have to do a lot of movement, you could potentially have a gap in your mask and breathe in room air. These devices will have positive pressure pushing that out. So even if you have a small gap in the mask, it's going to just push air out, not into your face masks. So we're very happy to see that. Niall Sally to my left has one ensemble, which is a Tyvek suit, and her capper. Again, these are reusable. The face shield comes off so the individual can be assigned a face shield, and then you can decontaminate the entire unit, recharge the battery, and use it again for the next provider. The filters, unlike an N95, are good for up to a year. So as long as they don't get soiled or dirty, you can continuously use those. You just have to decontaminate them. So with that being said, Portchester's here. Ossining EMS is here. We're going to provide this equipment to them, unless there's any specific questions.
Anybody else have anything they want to add to the
Good.
situation? Very good. Thank you all.
Thank you.
Great. I think we have one more example of intelligent technology brought to bear to try to help people deal with this pandemic. And we learn as we go along, and you see things improve. There was a period of time when this began where we weren't necessarily told we all had to wear masks, but with each passing month, additional effort being taken, and Mike and this program looks to be a good way to go, and we're happy that our friends in the community EMS will have this available to them. And so thank you all for coming and taking time out of your day. I have a few other points I want to mention for this update, and then certainly if there are any questions. If our friends who are watching in the press have any questions about the capper situation, I think we'd be better to do it offline, and you can contact Catherine Chaffee, our Director of Communications, and then she'll set up a separate interview with Mike and or any of the other people, because the kind of questions you would ask, you'd want to have time to have follow-up and feel comfortable with the detail of what's involved in this. So a few more things to be mentioned. First of all, vaccines. The topic of the day is certainly vaccines. We've seen now that Pfizer has had their vaccine distributed, the beginning of distribution around the country, and the Moderna vaccine has now been approved for COVID use just over the weekend. Each of these vaccines do require 2 doses spread out by a certain number of days in order to get the maximum effect. That both measures will have to be administered. The federal government and the state government have gone back and forth over how many doses of these vaccines are available within New York. As it stands now, the state government has tasked the Westchester Medical Center here in the Hudson Valley to be the vaccination hub for this region, the 7-county region of Lower Hudson Valley. They have put a plan together, state adoption review, as we speak, and probably by the first week of January we'll have a much clearer idea of when the vaccine is going to go to which individuals. Right now the priority, and that's who's getting the Pfizer vaccine, go to healthcare professionals, the people that are in constant contact with the disease, as you see from the capper structure, that every effort made to protect our medical workers are necessary. They're the people that save us if we go to the hospital sick. And if they become sick, if we lose them in being able to function, much less we lose them as to life, there's no way we can fight this disease. So healthcare professionals are the ones that are getting the first round of doses. And of course, you've seen some other prominent people get vaccine doses as a way to sort of, gain some confidence. And there's quite a bit of doubt from a lot of different people, and we have to talk through that. People just can't be talked at. They have to feel comfortable. They can express why they're upset. There's lots of reasons. There are some historical and societal reasons. There are some people who hold certain philosophies. There's just sort of the natural, what are the after effects? Will I hurt? Et cetera. And of course, because we're dealing with a vaccine that has been developed with proper medical procedure, but within a relatively short period of time, there's a number of logical questions that can't be answered at this point. How long is it? How long does it work? Will I have to get another shot a year from now? We don't know. We haven't had these things in force for a year to know what its efficacy is after 5 months, 6 months, 10 months, and so forth. And those questions aren't going to be knowable at this stage of the game. We do see vaccines as the light at the end of the tunnel, because without vaccines, then it's continual wearing of masks, social distancing, and then individual antibodies fighting off the disease for that percentage of us that have that success. And then for the percentage of us that don't have that antibody success, those people get seriously sick and pass away. Now with a vaccine, there's a hope that we'll be able to save more lives. So the vaccine distribution and presence is going to be very important to us. I would expect in future updates I'll have more specifics. I don't have them at this stage of the game. We also know that an effort is being made to work through the state of New York, work through some commercial pharmacies to disseminate the vaccine to nursing homes, both staff and patient. There we know we have a controlled environment of people, similar to healthcare workers, always working with those who are sick, but we have a cohort of people that we know are already hospitalized, in this case in a nursing home setting, because they have other comorbidity issues. And they are usually advanced age and with a host of other things. So they will get the vaccine next on the list, and those are going to be handled through, I believe, CVS and Walgreens, from my understanding, through the state of New York. Because of the nature of the vaccine being kept in cold conditions, the Pfizer has to be kept at super cold conditions, and the Moderna one still has to be refrigerated as well at some level. It is unlikely that we will see mass inoculations at a community center. Now, we do that for flu vaccines because we can do that. The flu vaccine does not require that type of refrigeration. But at the moment, with what's on the table, the control of the vaccines will go through very specific corridors. We'll know more. We'll report to you on when it is. Everybody knows, when can I get a vaccine? The most obvious thing to say, if you're between the ages of 18 and 65 and you're in good physical shape and you're relatively healthy, you get it last. And the people that get it before you will be people who are older, less well, in certain essential services, people who teach children, people who drive mass transit vehicles, and a host of them. I will take the vaccine whenever I am called to take it in that cohort. It'll probably be more because you want to see, whether or not I'm brave enough to get it, and we do it to show that this is a societal situation, but I'm not looking to jump the line over anybody. I want to make sure that the vaccines are distributed fairly, equally, and ultimately universally, because the only way we beat the pandemic ultimately is if the vast majority of the population is vaccinated against this, and that we resist then the spread of COVID. We are monitoring what we've heard about in England with a different strain of the COVID virus. Monitoring means that our medical professionals are looking at the issue, trying to make sure they advise us in whatever it is that we have to do to be prepared for that. Next thing I want to mention is donation of plasma, convalescent plasma, and the antibodies that are within those individuals who have successfully fought off the COVID virus. They have tested positive, they have gone through the period of time, they have come through it healthy, and within some reasonable period of time. It's generally thought that the antibodies diminish in your system as time gone by, so if you've had the virus in March or April, your level of antibodies are a lot less prominent than if you've gotten it more recently. There's two ways that you can donate convalescent plasma. It can be a whole blood donation with the plasma portions available, or it can be collected via automation. The most important thing to understand is that the New York Blood Center is the important point of contact for donation of blood. You can go online, pull up New York Blood Center. They'll give you the information, and then you'll set up an appointment time to go wherever it's possible. It's nybc.org/CP donor. That may be up on the screen. nybc.org/CP donor. And there's a donor request form. You fill that out, submit it, have a conversation. Hopefully, the New York Blood Center will be in contact with you, given the volume of submissions and the time needed for approval and so forth. Final point I want to mention has got nothing to do directly with COVID, but I know there's great frustration with the shutdown of the society as it is, and it isn't fully shut down as it was in the spring. Certainly we've seen in orange zone Portchester, yellow zone communities across the board, restrictions on dining, restrictions on certain kinds of businesses being open. On one hand, we want to defeat the virus. We want to have no more deaths added to that list of 1,606. At the same time, we're frustrated because things that we're accustomed to doing, holiday seasons, you can't enjoy it to the same degree. You can't have recreational outlets similar to what you want. If you're a sports fan, as I am, there's no going to the ballpark and watching a football game, or going to an ice skating rink and watching a hockey game, a professional hockey game, as we would have otherwise. So the amount of outdoor activities that are acceptable in this environment are fairly limited. Westchester County has provided 3 of them. We keep our public golf courses open, although it's snowed outside. I say that to remind golfers, because golfers will golf under any circumstances possible. And we've had a record number of golf rounds, and we're glad we were able to keep our 6 golf courses open. The golf courses will close January 3rd. If and when we have playable conditions between now and January 3rd, we welcome you to play our courses. But at this stage of the game, it's less likely you'll play any more golf. We will shut the courses down, or the courses need to repair in somewhat of an off-season. It's a short off-season. We tend to open it usually in the middle of March. But golf has stayed open throughout the course of the year. We have the Lasden Train Show, which is a wonderful train show that goes on at our Lasden facility, the estate that was donated to us, located on Route 35 in Somers in northern Westchester. You must have a reservation. There are time slots, and that's how you space people, by having time slots by which people can go through and not be in social close quarters with other individuals. This goes through December 31st, which is really not that far from now. We're only a few days until the end of the year, another 10 days. Santa will be with us until Christmas. After Christmas, he goes back to the North Pole. So if you want your kids to see the train show and Santa, then of course you have to do it sooner rather than later. And this program gets sold out pretty quickly. And then we have our Winter Wonderland program. We've had 33,000 tickets sold. This year it's a drive-through event. It's beautifully done in Kensico Dam Plaza, but we're almost out of available tickets. So if you have any interest in bringing the kids, throw them in the back of the car and take them through the drive-through of Winter Wonderland in Valhalla. Go online, right now. You can click me off, go online, westchestergov.com, look for information about Winter Wonderland, and get that ticket in if you want to. It'll be a lot of fun for the family. Those programs are still open. They're not shut down because they can be done properly with concern for COVID. So with that today, that brings us to the end of our update. I wanted to take some additional time to go over the map information. Hopefully that'll be resolved, if not by the end of the week, then sooner. And Catherine Chaffee is with us, our Director of Communications. Do we have any remote questions from the press?
Yes. So the first question comes from Samantha Crawford from News 12. How many doses of the Moderna vaccine is Westchester getting? And when will the first Westchester resident receive the Moderna vaccine?
Good question, Samantha. We don't have that information. That has not been released yet to us. So as soon as we know, we'll be happy to share it with you. But the state, in allocating where the vaccine goes and how much numbers have not shared with it that data, we'll try to find that out for you and provide that to you.
Next question also from Samantha. Nursing home vaccinations began today. Where have they started in Westchester?
Once again, the state controls the data. They haven't given us a grocery list of where they're giving out the vaccines. They assure us that they will be vaccinating people at every nursing home in Westchester County, but there's not been a public list announced of where they would go and over what time frame. And once again, I know that sounds very weak not to have this information. As I said up front, the state deals directly with these institutions. In this case, the collection of data as well as the implementation of the vaccine program. The county is not a direct player in the game. The state does not call the county and say, hey, county, will you do this and that? We try to be supportive of the efforts that they make, but we would not have a schedule like that. We can certainly try to get that information. If the state chooses to release it publicly, they may or may not choose to do that, but Samantha will reach out to you and try to connect you with people who might be able to answer those questions.
Next question also from News 12. You mentioned the new strain of coronavirus. Are there any steps you can take in your position as county executive to address the possibility that it could come here?
Well, we've asked the federal government, the Federal Aviation Administration, to help put some protocol in at Westchester County Airport, where we have individuals that might come from overseas. We don't have any direct flights. In fact, there's very few commercial flights, but we do have general aviation flights. That airport runway is not sufficiently long to warrant a plane taking off or landing from London or from the British Isles. So we would not have any direct flights that would happen. We are concerned that indirectly international flights might go into another American city or Canadian city, and then an individual will transfer from there to a flight that would take them into Westchester. That is not unusual. So we've asked the federal government to help us interdict with testing capacity at Westchester County Airport. Now, because we have very few commercial flights right now, it is much harder to deal with the general aviation situation, but we still need FAA approval in order to provide a testing component at the airport. That is what we're working on to try to interdict. Since right now the spread of this is in overseas in Europe, we are less concerned about the direct hit that we might have if we found that it was in states of the United States, in which case the movement between states is much more easily done and therefore much more difficult to track or to control.
And the last question is, what is your message to people ahead of Christmas and New Year's Eve?
Well, you know, that Christmas, Hanukkah, which is recently behind us, which our Jewish brothers and sisters celebrate. I'm Christian, and wish my fellow Christians a Merry Christmas. The celebration of Kwanzaa, which is a festival that happens after Christmas, predominantly in the African American community. We all recognize the turning of the page of the new year. All of these, what's implicit in all of these holidays is that something better happens in the future. And whether it's the story of Hanukkah and the perseverance of the Maccabees to overcome oppression, getting 8 days out of 1 day's worth of oil, whether it's the birth of the Savior to those of us who are Christian, whether it's the celebration of 7 principles that link those in the African American community through Kwanzaa, or the general 2021 has got to be better than 2020 because 2020 was so awful. Every one of us has a season of hope. It's impossible to answer every possible question. There's some questions you've asked me right now that I don't have an answer for, and I'm just very straightforward about it. If I have the information, I'm happy to share it. We have to live in a world, secularly, where we will not know the answer to every question. We're just not going to know it. But we still have to go forward with faith. The faith can come from something inside of us on a religious basis. It could be our own tough personality and our perseverance. It could be the faith that when you were a young athlete that got you to keep working on the practice field as tired as you were, but you still had to perform in whatever sport you were playing. It's the persistence when you're in a professional career that you have a demanding boss and that person puts you through paces. And it could be the perseverance that's shown by medical professionals who know they have to find an answer to this disease as fast as humanly possible, and it appears they have. We have people in this room who have fought fires in real-world times. I've never fought a fire. You see a building engaged with fire, you're trained to deal with it, but you also know that this is now a test of your physical ability, your mental ability, your ability to maintain your emotions under pressure to save life and save property. And all of those things happen out of faith. And so if there's a message for the season, it is to have faith, not blind faith. Don't put blind faith in any of us as people, but have faith that as a society, we will get through this and overcome this. And when you're a student of history, I used to wonder as a kid, why do you study history? It's all stuff that happened in the past. You try to draw a lesson. This country has been tested before. I've told many times, people in my age category, our parents went through the Depression. Our parents went through the Second World War. My grandfather fought in the First World War. I don't have any relatives that were here during the Civil War, but there are stories about that and all of the other different things that put Americans under pressure. We have survived these things, and we will survive them again, but you have to have faith that you're going to do this. You have to trust that there are professionals. I trust these EMS professionals to have the skill set. If I suffer a serious incident, that they can get me stabilized and to a place where I can get medical help, and if it's possible to save me, that they have the professional skill to do that. The men who sit here and women who've sat here that fought fires or have served as police officers, I have the faith in them that they can do that. I right now have people who are technically creating this media moment. That they have the right information, the right camera, the right voice sound, and they know how to project this. I speak, but their skill set is whether you hear me speak or whether you see this plausibly. We have lost faith in this society in so many ways because we have divisions in the society. We have disagreements, and we work the disagreements. And no one is going to tell you you must agree with somebody else. Democracy is you have debate, you have disagreement. But underneath it all has to be an overall faith in this season that we can get through this. And if you don't have that faith, then we won't get through this. But I think we will. I think, just as you saw the Capper devices shown, that somebody figured out this is how we overcome a problem where the masks or the normal shields don't work well enough. Let's come up with something better, and somebody figured it out. I can't figure it out, but somebody did. And that's how we work as a society. Everybody adds their unique talent, and together we get past it. That's what I think. That's what I hope, and that's what I pray. Thank you for watching. I'm George Latimer, County Executive. Stay safe. We'll report back again a little later this week. Hopefully we'll have good news. Have a wonderful day, and we hope you're having a good holiday season. Thank you for watching.